I just want to take this opportunity to talk to you about adult safeguarding and the additional pressures that COVID-19 are placing upon our vulnerable adults and upon services. There are likely consequences of people being out of sight and out of mind during this time, making our vulnerable service users potentially more vulnerable both to known and unknown abusers. We know that domestic abuse cases are likely to rise and victims may feel less able to report or leave the situation they are in. Please be mindful of this when reviewing your caseloads and in your conversations with known victims of domestic violence. And it will be really useful just to safely ask the question again, are you safe? Of course, if you do suspect domestic violence, do seek guidance of the safeguarding team. We are also aware that there is a possibility that known individuals and gangs feel less under pressure from scrutiny at this time by agencies, such as the police, ourselves, council workers, social workers, etc. If you have a service user who is particularly susceptible to or has been a victim of financial exploitation or any other form of exploitation, please do ask them how they are and if they are being pestered or harassed by anybody. Another emerging area of concern and to be mindful of is that of cuckooing, namely where vulnerable adults and their homes are being targeted by individuals or gangs to be used for illegal activity, usually selling or distributing illegal substances. And unfortunately, we're also seeing a rise in what is becoming known as COVID scams. People offering miracle cures or vaccines for coronavirus, bogus home cleaning services, people impersonating healthcare workers, emails saying that people can get refund on taxes at this time, fake products that are obviously unable to deliver on what they say, i.e. cure coronavirus, new mobile phone apps that claim to give you updates on coronavirus but lock your phone and demand a ransom, people offering to do people shopping for them and then asking for money and disappearing. And we've been informed by our police colleagues that there has been a spike in theft of ID badges, NHS and social care ID badges, where the criminals have then gone on to use them to gain people's confidence, get into their homes and steal or exploit them financially. So please do keep your ID badges safe and obviously report if they are missing. And as a frontline worker, you are the eyes and ears that may first pick up any signs of abuse. Here's a useful checklist from the Social Care Institute for Excellence of things that you can do. Talk to your patients, residents or clients about the increased risk of abuse at this time. Be aware that any changes in behaviour or demeanour could indicate abuse. Advise people not to answer the door to strangers and beware of fake ID. Try not to alarm people, but ask them to be wary of offers to help, particularly from strangers. Advise people to check with family, friends or paid support that offers of support, advice and help are legitimate. Warn people against responding to any text, email or phone call from an unidentified source. Explain that fraudsters will imitate official bodies such as the government or the NHS, and they will do it very well. Advise people that they should never give their personal data, passwords or PIN numbers to anybody. Official financial bodies and other organisations will never ask for them. If you know of a person who has been subjected to or is at risk of domestic abuse, if it is safe to talk to them, try to assess the current situation. Make sure that they know that help is available if they need it and who to contact both for advice and support and in any emergency. And please just to remind you that LYPFT Safeguarding is there for advice and we're there giving advice between 8 AM and 8 PM 7 days a week. Thank you.